Audio Jungle. Audio Jungle. Audio Jungle. Audio Jungle.
When patients first arrive here, they are often pretty anxious about food and what their diet's going to look like, and they meet with the dietitian on their first day to get a lay of the land of what our meal plans look like and what our menus have to offer. And so they are working with the dietitian to establish an initial meal plan, which is generally more or less like close to what they were eating prior to coming in, sometimes a bit more, just to start facilitating more normalized eating. But our goal is to not overwhelm patients with food on their first day, so we try to make it as easy of a transition as possible. And by the time they leave here, our goal is for them to have much more flexibility with food, acceptance of a wider variety of foods, more acceptance of the nutrition that their body needs, and ability to go out to restaurants and eat in social settings and maybe cook and prepare food for themselves and just feed themselves in a sustainable way.
I think historically, eating disorder treatment centers haven't really integrated fitness into their treatment model, and I think that the one thing that I love about McCallum Place and the Victory program is that we do support safe and intentional integration of fitness into our program. A lot of our patients have struggled with kind of trauma around fitness and exercise or body shaming. So really being mindful of that and giving support to them is really important to me. I really want to create a safe and supportive environment that's non-judgmental so that they can come in and really work through the struggles that they have.
All of our therapists are trained in cognitive behavioral therapy and dialectical behavior therapy, so that's kind of the base for all of the treatment that we provide. And then each clinician has their own specialized training. So some are trained in EMDR, interpersonal neurobiology, somatic experiencing, dance movement therapy, music therapy, art therapies. We use a lot of expressive therapies here. And then they carry those modalities into the groups that they facilitate as well.
Audio Jungle.
I feel honored to walk with individuals in our care kind of through treatment from the beginning stages and contemplating treatment, and then seeing the healing and restoration that can and will occur with proper care.
When a patient comes in and they're struggling, and especially if they've had severe malnutrition or there's medical complications, we often talk about this in the group process, that it will appear as though there's nothing behind their eyes, that they are really a shell and very enmeshed with their eating disorder. And as they evolve and they abstain from behaviors, they start to come to life again, and more of their personality starts to come through. They start to find their voice and re-engage with their community and their families and separate from their eating disorders.